Good afternoon, my name is Pharmacist Omose and I am the Chief Pharmacist at Havana Specialist Hospital. Now today I'm going to be talking about drug abuse, and while we're talking about drug abuse, we see that drug abuse is still something that is very widespread in our society today, and it is very important that we talk about it because we still have a lot of people abusing drugs, and some of these drugs are also still readily available to be abused. Now, when we say drug abuse, what do we mean? Drug abuse can be defined as the use of illegal drugs, prescription drugs, over-the-counter medications, whatever type of drug, in a way that it was not intended for originally, and also when you use them in excessive amounts. So it just tells you that it is not only certain type of drugs that are being abused. Different type of drugs, even the ones that are prescribed by the doctors and the pharmacists, are still being abused. And what are some of the examples of some of these medications? We have drugs like opioids, we have drugs like tramadol, which fall under the class of opioids. We have drugs like pain medications being abused in our society today. We have drugs like anti-malarials being abused, antibiotics being abused in our society today, drugs like heroin, people talk about morphine, pentazocine, all these drugs are being abused in the society today. And these drugs have potential to cause serious side effects, serious damages to the body. These damages do not just occur both to your physical body, it affects you emotionally, and it also affects their finances, because some people, when they become hooked on this medication, they will sell all they have in order to be able to buy some of these drugs just to further harm themselves with this medication. It's a vicious cycle that needs to be stopped, honestly. And why are we talking about it today? Because apart from these things that I just mentioned, we have people around us that we care about that are currently still abusing medications. So we can never stop talking about it, to be honest. We can never stop talking about the need to control drug abuse in our society today. And apart from these harmful side effects, there are ways at which we can combat this, drug abuse issue. One, by ensuring that we do not use drugs in a way that was not originally intended that they should be used. For instance, if your doctor says take 2 tablets, for instance, and you take 5 because you look at yourself and say, oh, I feel like I'm bigger than 2 tablets, this tiny tablet, what is it going to do to me? That's drug abuse. If you take tramadol, which is intended to secure your pain, and your doctor says take 2 and you take 10, that is drug abuse. And sometimes these side effects do not just come up immediately, they come progressively, they go from mild to severe, and before you blink, the damage is irreversible. That is if you do not even die on the spot from taking some of these medications. As pharmacists, we always say all drugs are poisons, all drugs have potential to harm your body, and that is why we counsel you on the use of these medications. And here at Havana, we pride ourselves in educating our patients on the use of their medications. We always tell them to feel free to ask over and over again how their drugs should be used and at what doses the drugs should be used, because it's important that patients are being counseled on how their drugs should be used. It's important that you do not give your neighbor medications that you already have at home just because it was previously prescribed for you. It is important that you advise them to go to the doctors for them to get their own prescriptions for these medications. We differ in our bodies. How I receive the medication is very different from how you will receive the medication. So it is important that you take your drugs in the right way. Please ensure that you visit your doctor, ensure that you visit your pharmacist if you ever need any clarification on the medication. And it's important, very, very, very important, that you stay away from drugs that have high risk or potential for addiction, because sometimes all it takes is one